So welcome to Pop Medicine with Fuchsiaangie. This is where I take time and talk about medical issues that have come up in popular culture. So a lot of you already know that Demi Lovato was recently hospitalized for a suspected drug overdose. TMZ was originally reporting that it was heroin. However, her rep had come out and said it wasn't. Now current news is saying that it is a confirmed opioid from close friends of hers. So what we do know also is that first responders did use Narcan at the scene, so I do think it's still really relevant, especially with the opioid crisis going on right now. So what I'll talk about first is heroin, Narcan, and then how it relates to anesthesia. So heroin is a morphine derivative. Morphine comes from the opium poppy, which all drugs stem from that plant. So you often will hear the term opioid in reference any opioid narcotics. And then Narcan is a opioid antidote that reverses respiratory depressant effects of opioid administration and also can treat opioid overdose. As a first responder, as a medical professional, your clinical assessment, you're looking for certain symptoms that would cause you to suspect an opioid overdose. So we would expect coma, sedation, a decrease in the respiratory rate, or apnea, which is complete cessation of breathing. We would also suspect meiosis, which is pupil constriction. Once you give Narcan, you would expect symptoms of wakefulness, potential nausea and vomiting, increase in pain perception. In anesthesia, we generally give Narcan in the post-operative period for patients with respiratory depression. The difference is the way we titrate Narcan is we want to only reverse the respiratory depressant effects of the opioid administration, not just the actual pain control. So when you give Narcan, you're not only reversing the respiratory depression effects, you're also reversing the pain control that comes along with that. And so something to also be told is if a patient is physically dependent on opioids, you can potentially incite them going into a withdrawal episode. However, if you're suspecting a potential opioid overdose, you still need to give Narcan because having an opioid overdose is a medical emergency. So wishing Demi Lovato the best with her recovery and her sobriety, and hope she does better. And anyone else who may be suffering from an opioid addiction or has a friend or family member who is, it's hard on everybody. But if you guys have any other topics you want to hear about or you want commentary on, feel free to comment, like, and share. Let me know what you think.